Welcome to this quick overview of respiratory management and neuromuscular disease. In this video, we'll be sharing an acute care case example to highlight essential management pearls for patients with neuromuscular respiratory muscle weakness, and specifically for patients with ALS. Hey, Dr. Ang, quick question for you. We've got a 75-year-old male with a history of ALS in room 4. He's in respiratory distress, no signs of infection.
Okay.
We were thinking of starting him on supplemental oxygen, 4 liters. Does that sound okay?
Before you start oxygen, tell me more about his baseline.
He was diagnosed with limb-onset ALS 2 years ago, and his last FVC was 50%. His oxygen saturation is dipping, so we wanted to stabilize his levels before we do the full workup.
Remember that even in mild weakness, patients with ALS can develop severe pulmonary abnormalities. They actually maintain their oxygen while secretly retaining CO2.
So if we give him supplemental oxygen now,
You'll see a beautiful 98% on the monitor, but he may slip into hypercapnic failure since he's not actually ventilating to expel his carbon dioxide.
right. If we fix the hypoxia without addressing the ventilation, we're risking making it worse. He's still handling his secretions well. No severe bulbar issues yet.
Exactly, so what's your move?
What is the next best step for the patient? The correct answer is B. Place BiPAP on the patient. Because the patient is experiencing neuromuscular weakness, the underlying issue is ventilation, not just oxygenation. Since he can still handle his oral secretions, non-invasive ventilation is a preferred choice. So we'll skip the supplemental O2, we'll go straight to NIV. We'll start him on BiPAP, and that'll help support the mechanics to clear the CO2, and I'll monitor his CO2 levels alongside his SATs.
Good call. And remember, if your workup shows something like pneumonia or underlying parenchymal lung disease, it's always okay to add oxygen once you have them on BiPAP to sufficiently ventilate. But if isolated respiratory muscle weakness is your main issue, then always BiPAP first.
Got it. That makes sense. Thanks so much, Dr. Ang.
When taking care of patients with ALS and other patients with neuromuscular-related respiratory muscle weakness, caution must be taken when using supplemental oxygen as treatment. Supplemental oxygen can worsen respiratory failure for these patients, as it can worsen VQ matching and reduce central respiratory drive. It is best to monitor CO2 levels and plan to use non-invasive ventilation such as BiPAP to help with hypercapnia, as long as they don't have important contraindications like bulbar weakness and aspiration.